Great. Well, welcome everyone. Thank you very much for attending our briefing on how the state is responding to slowing the spread of virus here in Nebraska. We, as always, will remind you what day we're on, and today is 21 of our 21 days to stay home, stay healthy, stay connected. So thank you to all the Nebraskans for exercising patience as we went through our 21 days and really working on trying to stay home so we slow the spread of coronavirus here in Nebraska. Really appreciate everybody's cooperation and everything every Nebraskan is doing to slow the spread of virus here in our state. Now, I want to go over our rules though, because we still have our stay home, it's still our, today's date 21, so we're not done yet, it's still April 30th. Remember that we want people to stay home, that we don't want you to take unnecessary trips outside the household, that we want you to work, number 2, but work from home if you can, and also if you go into the workplace, use socially distancing guidelines, all that physical distancing, 6 feet apart, that sort of thing. 3, shop. Shop once a week and shop alone. Don't take the whole family. Have a list. Be prepared, be organized, go in, get out. 4, help kids socially distance. Make sure that they are playing at home, not playing in large group sports or at the playground. Number 5 is help seniors to be able to socially distance by running errands for them. Making sure that they can stay home or shop for them, things like that. But do not go visit them in a long-term care facility. We are keeping those separated right now because that's a vulnerable population and we don't want to have coronavirus there. So don't go visit folks there. So again, now people may be asking, okay, you've done your 21 days to stay home and stay healthy. It's April 30th. Does that mean tomorrow we can rush right out and go do anything we want? And the answer is no. As I've mentioned, we are going to start loosening guidelines gradually at a piece of a time. So we will still be under the 10-person rule as we go into the month of May, right? For the month of May, we're planning on being at that 10-person rule. So as you look at things such as celebrating Cinco de Mayo or Memorial Day, still the best practice is going to be just celebrate with your household. But at the very least, keep those celebrations to 10 people or less, because we still will be on the 10-person rule. So while we're starting to loosen some of the restrictions here, we want you to still practice the 10-person rule, the 6-foot rule, washing your hands often with soap and water, 20 seconds at a time, making sure you're coughing into your elbow, all the good hygiene, all the good sanitation we've talked about. We want to continue to practice that through the month of May. We are loosening some of the restrictions we've talked about earlier in the week, but again, we want people, and even when we're in the month of May, going shopping, still go shop alone, just one person, and do it once a week. If you're at home, try and limit those trips outside the home to just the ones that are really essential. So those are the sorts of things we're going to continue to practice into May, even as we end our 21 days of staying home. Okay, so we want to continue to practice good social distancing guidelines. Test reminder, testnebraska.com. We've got 110,000 people signed up now. That's great. We want more people to sign up. There have been a question asked about updating your profile. For now, the way that will work is when you are scheduled to go get your test at Test Nebraska, you will be given the opportunity to be able to update that profile at that time. So that'll be kind of the next opportunity you'll have to change that profile. And what we're doing is we're working on getting that lab set up right now. And then we will start testing people next week. And just as we kind of work the system out, it's going to be slow at first. Just want to set everybody's expectations, but then we'll expect to ramp that up as we go on and get kind of the system down for how we want to do this. So just want to set everybody's expectations there. Again, the first 2 sites, one will be in Omaha, the second one will be in Grand Island. We want people to sign up, especially in those surrounding communities. So again, if you're especially in Omaha and Grand Island, sign up, but everybody should sign up for testnebraska.com. And once you sign up, first of all, it's a quick survey. It's less than 5 minutes to get it done. Your data will be secured in an encrypted database, only used by the state, will not be sold individually or in aggregate. So go sign up and then go challenge 5 of your friends to do it too. Hashtag Test Nebraska Challenge. So get other 5 people to go out. Let's make this thing go viral. Have the social media viral thing going to fight the virus. All right, so unemployment. So we've obviously gotten a lot of questions about the unemployment program, and just again, I want to emphasize that we've received a large number of claims. This week's initial claims were 8,000, which is down from about the 12,000 the previous week, so we've seen about a third reduction. And it's about a third as our peak, when the peak was about 24,500, is that right? 26,000, so down more than so less than a third from our peak. So, but still, we have in the last 2 months taken in about as many applications as we had done the previous 2 years combined. So over the last 2 months, we've had many people apply as the previous 2 years combined. Now, we've taken the staff up from 34 to 166, and one of the other things that I asked John Alban to do and his team to do is what are other ways that we can make sure that we're processing these things faster? So, John, one of the things also I talk about with our team all the time is continuous improvement, always looking for ways to do things better, right, John? We're always talking continuous improvement. And I'm also about, hey, go steal other people's good ideas, right?
Yes.
Right, I'm about that too. So the state of Tennessee had a program where one of the ways they were able to accelerate their process of processing the unemployment applications is they were not adjudicating all the employment the person had. They were just doing the last place of employment. And so that's one of the things that helped them figure out, rather than having to contact all those employers, they had to contact the last employer and verify and adjudicate that employment for the person who was requesting those benefits. So that's one of the things that we're going to be doing now. I just signed an executive order. So this is one that's going to update Executive Order 04, 14, and 19 that will waive that requirement. It's Nebraska Statute 48-626. That requires us to go back and adjudicate all those previous employments, all those previous employers. So we're waiving that statute to allow the team and the Department of Labor to just do the last employer, and that will allow us to pick up the pace and be able to get these processed in a much more timely manner. So that's one of the steps we're doing. Also, we received a question at one of the town halls I had on NET about the executive orders and why they didn't go back to January. And first of all, we weren't impacted by the coronavirus in January, so that's why we wouldn't go back and waive an executive order going back that far. However, if you look at 20-14, we made it effective March 22nd, but it was a fair point that we'd actually started declaring emergencies on March 13. So we went back, and the new executive order will amend that to go back to March 15th and give everybody an extra week of eligibility with regard to unemployment benefits. So, and all the other things as part of those executive orders will be updated as well. So, John Alban, our Commissioner of Labor, is going to go into more detail about the new executive order, excuse me, and how that is going to help us process these claims faster. And then, John, we also, I'm throwing a curveball at you because I forgot to brief you on this. We also had, do you know the stats on how we're doing with regard to how many claims we're getting paid between 21 and 28 days? I know I should have talked about that one ahead of time. Sorry about that. Surprise.
Exact stat.
Okay, you know the exact stat?
No.
Oh, see if you can, okay, Taylor, see if you can find somebody in the Department of Labor to get us an answer while John's up here talking, and maybe we can get that answer before the end of the briefing. With that, John, I'm going to have you come up and talk a little bit more.
All right.
Great, thanks.
All right, well, thank you, and not to contradict my boss, but actually we've taken in the equivalent of 3 years' worth of claims in 2 months. We've paid out 2 years' worth of claims in that time. But if you do that math, we're still getting behind farther and farther, or getting not behind further and further, but we're not catching up like we really want to catch up. So, yeah, as the governor said, we're always asked for ways that we can move the process along. Our friends in Tennessee have used the system that we're using. It dramatically improved the timing of the processing of their claims. And just kind of to give you an example, because I know various reporters have said, well, this person that was a coworker got paid immediately and the other one, they're still waiting. And why is that? Well, 40% of our claimants have multiple employers in their base period, and under 48-626, we have to go back and adjudicate each one of those base period employers. And that means you have to reach out to all of them, you have to get their information, you have to do rebuttals if they provide contradictory information on the separation. And just to give you one example, and I think our all-time record in Nebraska was 20-some in one person's base period, but I got a call from, or email from a waitress one day, and I went back and looked in her claim, and you know, she had a heart of gold. She was always moving to a better job, but she had 8 different employers in her base period. I mean, she was a good waitress. Everybody liked her, but she got a better job elsewhere. Well, And then she got laid off because of COVID-19 on that last employment. So under this policy, we wouldn't even look at those other 7. The employers don't get charged for those benefits, so there's no harm to the employers, and it speeds up the processing for the claimants. We really think it's going to be a substantial improvement in the process, especially as to the new, we're going to run a script program tonight to recalculate all of those claims so that we can pull out those where that multiple employers in the base period issue was stopping us. On the part of the executive order where we go back to taking it back to March 15th, people don't have to worry about it. They don't have to call, write, or anything else. We will run another computer program to pull those claims out and apply the same rules that would have applied if the executive order had originally been in effect on March 15th. So those should really help improve the process. As you might imagine, the multiple employers has just been a huge backlog for us because a lot of the employers, if it's a waitress or a bartender, the place of employment is closed, so you have to struggle to get the information from them because there's nobody there right now because they're closed. And so we think this will be a substantial improvement, and we're really grateful that the governor was willing to go to that point for us. Probably a little bit of update for those of you who are last week we talked about the PUA claims, Pandemic Unemployment Assistance, that we had the new software up. We did, in fact, have made first payments now to over 11,000 Pandemic Unemployment Assistance claimants. There's about 5,500 others that we think are going to be eligible, but we have to get more information from them, and that's job one for the crew for today and probably tomorrow and Saturday to get caught up with those people so we can get all those claims brought through, because a lot of those are our older claims because we didn't have software to process their claim when they filed back in early March or mid-March, and now we've got it, and so we're running it. If you like dollars, we paid out about $7 million this week for those PUA claims. We've paid out $11.6 million for regular unemployment and over $45 million for the FPUC payments. And I think I told you last week we were going to get those caught up. The FPUC payments, every week that's been allowed so far.
Can you explain exactly what stands for there, John?
Federal Pandemic Unemployment Compensation. That's the $600. Everybody knows it by $600, but the feds do love their acronyms. I told you last week we're going to go back and catch up those because we processed the first week that was eligible, but we hadn't had the software in place to we paid the second week, but hadn't had the process in place to do the first week. We've now caught up with that first week. So this week we have paid out so far, and it's still running up, we're just shy of $64 million in unemployment benefits of one sort or another. And the 11.6 that we've paid in state benefits, that is more than twice what we paid in our highest year of the Great Recession. The greatest week of the Great Recession was $5.4 million, and this week we've more than doubled that in regular unemployment benefits, and then the other programs bring us up to that $63.9 million figure that we've got. So, it's kind of an odd situation when you look at it. The governor talked about the number of claims were down substantially, and they were. Over 8,002. It was a third of what was the week before, or a 33% decrease from the week before, more than a third increase or decrease from the peak year. But yet, even though it's the lowest of the last 6 weeks, it's also in the top 6 weeks of claims ever filed. It's still basically double any other week in our history in terms of payments. So on projects, we're working on a new, once we get this executive order run tonight, we're going to rerun our schedulers so we can move up any older claims. We're trying to come up with a better method to identify those older claims, and I think we're on the verge of getting that launched hopefully tonight, if not before the weekend for sure. And so that will also be an aid to help on those older claims, because we recognize there's some out there that have languished too long, and so we're reprioritize and spread those claims over the entire 166-person team and get them moving up front, because it doesn't meet our standards, and I'm sure or what we expected. On the numbers for the 28 days, unfortunately, the federal software that we built our system around doesn't measure that. I don't know why. It does on certain parts of the unemployment program, but not on claims. So, my best guess, and looking at it right now, and maybe they'll text Taylor with something in between, is that we're probably not meeting my 75% goal. I don't think that's uncommon. There was just an article in ABC News this morning about how states are struggling. I think the state of Florida, they said, had paid only 9% of the claims that have been filed there since the start of the pandemic outbreak. We're a lot better than that, but every state has struggled because the numbers are just unparalleled in our system. So, thank you.
Thank you very much, Commissioner Allen. So don't go too far. I'm sure we're going to have lots of questions for you. So next we wanted to hit upon one of the things that we had done to start making relaxations in the month of May, and that was to start religious services. Starting May 4th, houses of worship will be able to be exempt from the 10-person rule I just talked about. So 10-person rule through May, but not for houses of worship. And this is a statewide directed health measure, so it applies across the entire state. But even though houses of worship will be able to bring in congregants again, they will have to have certain restrictions. So for example, we're going to ask families, households, to sit together, including the children, everybody sit together, but 6 feet apart from everybody else. That there's going to have to be restrictions with regard to, you can't have, hymnals, for example, in the pews, because different people picking that up and using it could spread the virus. So it'll be okay if individual families want to bring in their own hymnals or their own, books of worship, but you can't leave those for somebody else to then come pick up. You can't trade them around the congregants. There'll be no passing of the plate around congregations. Again, what we're really trying to do is limit that interaction between congregants so that they're not spreading the virus. And of course, we'll want pews and everything else wiped down and sanitized between services. There's a number of other guidance that we're putting out as part of our guidance for how houses of worship can start operating under not the 10-person rule, but under a wider guideline to have more people in there. So we've got a couple of folks who are going to come in here and help talk about this a little bit further. Father Christopher Kubat, pastor at St. Cecilia Church in Hastings, is going to be here, as well as Pastor Rich Snow, Nebraska District President of the Lutheran Church Missouri Synod, is going to be here to talk as well. And I'll ask Father Kubat to come up and talk a little bit, and then we'll have Pastor Snow talk about how they are going to be putting guidelines in place to allow their congregants to be able to come and worship and do it in a way that is going to be within the guidelines and help slow the spread of the virus. So, Father Kubat.
I'd like to thank Governor Ricketts and Lieutenant Governor Foley for this invitation, this opportunity, privilege of working together to put some guidelines together for pastors across Nebraska as we start opening up our churches for religious services and Mass. And the heart and soul of this is that people who are at risk are urged to stay home, and people should be reassured that the dispensation from their Sunday Mass obligation is still in force. So those who are at risk are urged to stay home. And who are those? Elderly people, people that live with elderly individuals, people that have underlying medical conditions. Maybe they have a cardiac pulmonary condition, asthma, perhaps diabetes. There are other conditions. Maybe their immune system's suppressed for whatever reason. The urge to stay at home. And if you're living with somebody that has illnesses that puts them at risk, you're urged to stay home as well. Members who, people who are symptomatic, have cold and flu-like symptoms, you need to stay home. If you live with somebody that's symptomatic, you need to stay home. If you live with somebody, obviously this is a no-brainer with the virus. If you have the virus, you need to stay home, even if your symptoms are minimal. If you live with somebody that has the virus, you shouldn't be at church. If you've been exposed to somebody you need to stay at home. So all these people that are at risk are urged to stay home, and then the rest of the people that are going to come to church, we have these guidelines to follow. As Governor Ricketts said, family units are to sit together, 6 feet apart, individuals too, and we're going to space them every other pew, so pews can be taped off, because not everyone's going to get the memo, and there's only so many ushers. So if you tape the pews, every other pew, people will get the message pretty quickly. And no passing of the collection basket. There'll be a centralized collection basket for the weekly offering. And no hand holding, no sign of peace. At least at this time, the holy water fonts will remain dry. And the ushers then, when Mass is over, will dismiss the congregants pew by pew. So it's not a mass of people exiting at the same time. Ushers can also open the doors so when people come in to the churches that they're not all touching the doors. So afterwards, the pews, the restrooms, the door handles are all to be sanitized, and we've been doing that already. The churches have been open for adoration, and we have a 6-foot buffer in the sacristy, so when they come in for confession, they're nowhere near the priest. And that needs to continue, so not use the small confessionals. And then also, as Governor Ricketts said, the hymnals and the missalettes will be removed, because otherwise they'll be passed from one party to another and put people at risk. And this only refers to masses and liturgies, but not coffee and rolls or meetings of various church groups. And we're going to wait for further guidance on that. But the 10-person rule applies. So, but that's really the heart and soul of the guidelines. I think it was pretty complete there. Any questions, feel free to ask. But the two main elements, those are at risk to stay away, and those that do come, adhere to these guidelines. Thank you.
Good afternoon. Father's already mentioned all the restrictions and guidelines that are in place. We're a little bit different system, congregational rather than hierarchical, so our recommendations will continue to follow the governor's restrictions. Again, for those who are at risk, stay home. Those who are sick, stay home. Again, looking at either roping off or designating spots for families to sit. In some churches, it'll be actually 2 or 3 pews apart, depending upon spacing, and so each congregation looking at those spaces. Maintaining it, we've talked a lot about also leaving a marker where a family has been so that extra work can be done, making sure that that area especially is sanitized. So those are, again, I don't think I'll repeat what Father's already said about most of the stuff. Again, I think the other thing that we've been really looking at is start slow, take care. The whole purpose of this is to care for the least and the last. We want to be careful for those who are weak, and yet, again, we also understand the importance of faith, nurturing folks through crisis. And so we want to encourage, again, continued presence digitally, whether that's online, radio, or TV, maintaining that presence so people can be fed spiritually in that way. And those who are able to gather and wish to gather, again, freedom to do that, freedom to stay home, and in all of that, with that freedom, the opportunity, again, to continue to grow and nurture in their faith. So, again, also wanted to thank the governor and his staff. They've been very responsive, working with various churches and pastors to see how we can do this in the best way, the safest way, again, continuing to care for the spiritual well-being of our state. So I want to thank the governor and his staff for that. Thank you.
Great. Thank you very much, Pastor Snow, and Father Kubat, thank you much. And I also want to especially thank my Lieutenant Governor Mike Foley, because he was the one that reached out to the faith leaders to be able to work on these guidelines. And so thank you very much, Mike, for your work on this important topic. Okay. Just a couple of other things before we get to questions and answers. Accommodation update. So we have accommodations for our first responders in hotel rooms, and we have 25 people who are taking advantage of that. So that is great news. In fact, 11 of them are in Grand Island. So again, you can see in a community that is probably the most impacted of any of our communities here in Nebraska. We've got first responders taking advantage of that, so great program there. And then we also have, as part of our Nebraska Accommodation project, we have dorm rooms that have been made available at UNO, UNL, and UNK. We've got 7 people using them at UNO, 7 guests, and then we've got 1 guest on the campus of UNK. So those are starting to be used. We certainly want to get that word out wider. And we're looking for alternative accommodations in some places like Grand Island, again, to be able to do more there. So appreciate all the folks who are working to be able to make those programs happen. And again, if you are interested in these programs, you can go to our website, www.dhhs.ne.gov/coronavirus. Look for the Nebraska Accommodation Project, and you can get more information. You do have to work with your local public health departments to be able to access the program. For example, we do ask to verify employment so that we know you're a first responder, for example. So those are some of the things that we do ask the questions. To be able to access the dorms, you do have to be somebody who's impacted, who doesn't have any place else to stay, would put others at risk by going home, that sort of thing. So there are some qualifications for that, but that's why we ask you to work with your local public health department. Also, University of Nebraska has a program where they've got a number of folks who are making hand sanitizer. In fact, they've made 20,000 gallons of that so far and are distributing it to people who need it, local health organizations and so forth. I think they've worked with 100 organizations to be able to get that distributed. They've got a GoFundMe account to be able to do that as well. So just want to say congratulations to the folks who organized that at UNL. And then also scheduled for this week, we've obviously got our English language briefings tomorrow, 2 p.m. Central Time. And then today we've got our Spanish language briefing at 5 p.m. Central Time. And then I'll be on NET at 8:30 Central Time on the Speaking of Nebraska program. So with that, we are going to go ahead and get into our questions. Doug Kennedy, KWBE, it appears some health districts will release the addresses of known positive COVID-19 patients to first responders, yet other public health districts are not. First responders see this as a safety concern if they should respond to an address where someone has been tested positive. First responders say the information allows them to appropriately be prepared with protective gear when they respond to those residences. What is your position on how health districts are handling the release of information to first responders and why it appears to differ across the state? So first of all, I would say to first responders, you should prepare that every household you go to is got somebody who's tested positive for coronavirus, right? This is something that even if the person has tested positive and the health department knows, maybe that person's not there and somebody else is, but if you go to, there are also households that we know that probably have somebody who's testing positive, or would be tested positive if they were tested, but they have coronavirus, have not been tested, so you really have to treat every household like they've got coronavirus. Okay, so that's the first rule for all first responders. Treat everybody like they got it. Second, with regard to the public health districts, the reason it's different across the state is because that is a local decision for the public health department to make. They need to work with local law enforcement officials to make that decision, so it is really up to the local health departments to decide how they want to handle it. Melanie Wilkinson from York News Times, which I always sometimes read that and go New York Times. It's like not the same thing at all. All right, Melanie knows. Anyway, so can you address the potential timeline for wedding receptions, conventions, large meetings, banquets, etc., as there are businesses such as convention centers, catering companies, DJs, decorators, cake companies, etc., as well as clients who are wondering about future potential dates, as well as bottleneck of rebookings once they can go back to work? Could a potential date be set as a guideline? So I can tell you for sure through the month of May that wedding receptions and all those other things you just listed will not be possible. It's all subject to the 10-person rule. So you will not have to worry about that through the month of May. We understand that a lot of people are seeking guidance on this, and a lot will depend upon, again, how the data starts coming together in May as we started releasing some of these other restrictions. So we're going to take some small steps here. We'll see how it works over a couple of weeks. We'll be working on some guidance to be able to give you for the month of June. But right now, again, I can tell you for sure you will not be able to do those sorts of things in the month of May. Again, we're still under the 10-person rule. Joanne Young, Lincoln Journal-Star. The governor has referred to some cell phone data that indicate people might be picking up virus at grocery stores. Can you tell me what cell phone data he was talking about? And the theory where some people were being exposed at grocery stores, it wouldn't surprise me, because a lot of people seem to be pretty cavalier when they go to shop, with no mask, no gloves, no distancing. Some employees do the same. I think people should be interested in the data. It might persuade some to follow the governor's suggestions about only one family member, get in, get out quickly. I can't tell you exactly where I got that. The point being, though, however, when you're going out in public, again, you want to take all those appropriate social distancing guidelines. You know, wear a mask. That would be great, right? That would be a good thing. And especially when you're going to the grocery store, I really need to emphasize, please go by yourself, one person, and be efficient. Don't touch everything in there in the store. Just pick up the things you're going to take. It is a point where you could get the virus because it's a public access place. So I'm sorry, Joanne, I can't tell you exactly where I got that, but there's been a lot of data and information out there. But the general idea is grocery stores are a special place to be careful. Mike Spataro, KKPR. The governor signed an executive order allowing health districts to release information. Oh, I think we covered this one already. Release information regarding COVID-19 cases to the protection of for the protection of first responders. Mayor Stan Klaus of Kearney says that they have asked for that information. Again, this is up to the local public health districts to be able to work with law enforcement and make that decision. Christian Wagner, NTV. My daughter, a college student at UNL, was laid off from her job at Lincoln in March due to COVID-19. She applied for unemployment over 5 weeks ago and still hasn't received any benefits. Her claims continue to say in progress. I know those who applied just a week ago and are currently receiving unemployment benefits. I'm wondering if you have recently contacted the Nebraska Department of Labor to ascertain why some of those claims are taking so long. We have emailed and called several times, but have yet to receive a response. So again, a couple things here as I read this. First of all, as a college student, especially if you're on work study, you would not ordinarily be entitled to unemployment benefits. And remember, I said that the Pandemic Unemployment Assistance Program, while it was signed a few weeks ago, we had developed a software, and so we just got that software developed over the weekend, last weekend, and that started processing this week. So if she was in that group that would not normally get unemployment benefits because she wouldn't qualify under work study, that program is starting to run this week. As John mentioned, there's 11,065 claims you did process under that this week, so that's probably why it's in progress with regard to her getting that, and why somebody else who maybe have been a full-time person who was eligible under the old employment program was able to get paid out. So we do have to keep that in mind, that because there's different programs, you may get paid at a different rate from somebody else. And again, also, what John was talking about, if you were somebody who had a lot of employment history up until your last claim, up until I signed this executive order, all those would have had to be checked out, versus somebody who didn't have those, they would have been able to get theirs processed more quickly. So there are some reasons why people's claims may be paid at different rates. Okay, so now we're going to Shannon Hecht at KSNB. Will there be transportation for people who have been accepted to stay on the UNK campus? No, actually, we're not providing transportation for that. You will have to arrange your own transportation. We have seen a major need for quarantine sites in central Nebraska. The application asks if employer is aware of someone requesting accommodation. Will employers be notified? Do they need to be? Again, this is, I think, in part to be able to verify that somebody maybe is a first responder or is employed or so forth. So I don't know that we're actually reaching out to employers other than to verify that employment status. Martha Stoddard, Omaha World Herald. What are your plans regarding the directed health measures for Elkhorn-Logan Valley Public Health District, which is Madison, Stanton, Cumming, and Burt counties, which expires May 6th. We have not made the announcement with regard to what will happen with that public health district yet, so stay tuned on that one. Nick Amantan, I'm going to get your name wrong, sorry, Nick. Nick Amantangello. Sorry, Nick. KETV. Nebraska is eligible for more than $50 million in federal funding to help provide food assistance to kids and families through the FFCRA, Family First Coronavirus Relief Act, but has not submitted a proposal to the USDA. Is Nebraska planning on doing that? And if not, why not? We'll have to get back to you on that one, Nick. I don't know that I've got the information specifically with regard to that program. Do I, Taylor? Do I have the information on that one? Not yet. Okay, Taylor's saying no, I don't have the information on that one yet. So, Taylor, take a note on that one. We'll have to get back to Nick. Charlie Brogan, KFOR. There appear to be two types of tests. One is where you find out whether you have the virus at that moment, and the other is where you find out whether you've had it in the past and recovered. The Test Nebraska initiative appears to be the offering of the first type. Is the second type the finding out whether or not you've had it and recovered, available to the public? If not, when will be made available at some point? So, Charlie, you're exactly right. So the first test is what we call the antigen test. This is the one we've been talking about, where we search for the RNA of the virus by taking that swab that goes all the way up into your nasal cavity. It's very uncomfortable to get that done, but that's how we make sure we get a good sample. And then we test to see if we can find that RNA to see if you've actually got the virus currently. And that's the first kind of test, and that's the one we're setting up for Test Nebraska. There's another kind of test that is a finger stick. They have to get a little bit of sample of the blood, and that checks to see if you've got the antibodies for the virus. Now, you can start forming antibodies if you've been infected for about 3 or 4 days. So it may not tell you exactly that you've got it currently, because if you're in that early stage before you start developing antibodies, you could have the virus, and it would show you don't have antibodies, so it wouldn't tell you anything. And then, of course, you could still actively be sick and infecting other people, even though you've got the antibodies, as you're going through the course of the virus. The antibody test is not approved yet, and so it's not out there widely available. I do think that this has hope for us to be able to use in conjunction with other sorts of tests or in other functions, but for our purposes, for the state of Nebraska, as far as doing contact tracing, really is the first test, which we are setting up, that's the important one. We want to determine if somebody has a virus at that moment, so we can isolate them, go back and find your contacts for the last 2 weeks, get those people to quarantine as part of our strategy to be able to, again, isolate the virus, get people quarantined, and slow down the virus here in our state. So we are focused on, with Test Nebraska, on the first of those, the former of those. The latter of, which is not widely available yet, it'll have to go through the process, get approved, and so forth, and then we'll be able to. Ruta Elson, okay, okay, so I'm sorry, Ruta. Are these all people the same KMTV? Nick is at KETV, sorry, okay. What is your advice for people who have yet to receive unemployment benefits past 28 days of processing period? Again, I think we've covered that. We are taking steps to be able to get those accelerated and hope to be able to get on top of that in the very near future. So just please stay patient for us. And again, there may be good reason if you're not traditionally covered, or those are self-employed or those student workers. The Pandemic Unemployment Assistance Program is processing this week. Mark Bomber, KSNB. Grand Island Mayor Roger Steele said this morning that since President Trump has ordered meatpacking plants to stay open, it's up to the federal government to provide testing for workers at JBS plant. Does he agree? It's the federal government's responsibility. Major Steele will also ask Ag Secretary Senator Perdue to visit Grand Island. Will Governor Ricketts support Mayor Steele's request for a visit, and if so, how? So first of all, with regard to President Trump, I appreciate President Trump making that executive order because it highlights how important our food processing industry is to the supply chain here in the United States and making sure people have food on their grocery shelves grocery shelves at the store. I would certainly accept help from the federal government to be able to do more with regard to testing. In fact, we are getting some resources from the federal government to be able to help do more of our contact tracing. So we are getting some of those resources, but again, we would certainly accept more help. And with regard to Sonny Perdue here, we would certainly welcome Sonny Perdue to come here. The Ag Secretary prior to this pandemic had been to Nebraska a number of times, and so we'd certainly support him coming to Nebraska. Taylor, other questions that have been texted in?
Don Walt wants to know, the Lincoln's mayor says the city reserves the right to reconsider relaxing virus restrictions on May 11th. Do you support her authority?
So Don Walton is asking, the Lincoln mayor said Lincoln reserves the right to, about the relaxation of health measures on May 11th, and within the scope of what they can do at the city, the mayor can certainly do that. So for example, in Omaha, the mayor there closed city parks when she felt that was appropriate. That was within her purview to be able to do that. Certainly they can do the same sort of things here in Lincoln as well.
Bon Jones from KTV, can you explain why we continue to see discrepancies between the number of COVID-19 cases reported by local health departments and the numbers reported by HHS?
So Von Jones, KETV, is asking, why are there discrepancies between what's being reported by local public health departments versus what is reported on the state's website? Local public health departments actually get their data first, and then they report it to us. So they get the data ahead of us, and then they typically report it out before us. We gather all that data in from all the public health districts, and once a day we update our website. So we're only updating every 24 hours, whereas I believe many of the public health districts, as soon as they have the information, they're putting it out to the public. So it's basically a timing issue with regard to when we're getting the data and when we publish it.
Andrew Ozaki wants to know how many inmates have been tested for COVID, and will they be included in Test Nebraska?
Andrew Osaki wants to know how many inmates have been tested for coronavirus, and with regard, and will they be included in Test Nebraska? The inmates are being treated just like everybody else. So, for example, if we have somebody who tests positive, we do the contact tracing, we ask those people to quarantine, and so forth, monitor healthcare conditions. They will not be a part of Test Nebraska. Again, that is a program that is going to be for people who can publicly attend the, go to our drive-up, tents or whatever we're going to be using to be able to take those tests. But again, if we have people who need to get tested in our corrections institutions, they'll be treated just like everybody else that goes into the hospital or anything else with regard to getting that testing.
Sarah Kirkley with NTV says that Kearney's police chief is complaining about the public health department not releasing information about COVID positive patients. Was it your intent with your executive order to have them do so?
So Sarah Kirkley is asking again, the police chief in Kearney is saying the public health district is not providing them the data with regard to who's testing positive. Was it my intent for them to do that? Actually, it was not. When we signed that executive order that allowed for public health departments to be able to share that information with local law enforcement, it was up to them to really make that decision on a public health department basis at a local level, working with their local law enforcement. The intent of why we signed that executive order was to allow our own data to be shared from our own state data to be shared with regard to knee-high and the knowledge center that we put together to really pull in all the data we're trying to pull together from all the hospitals across the state. It's one statute. I waived the statute so I could be able to get my own data to be shared into our overall dashboard. The ramification was that local public health districts could do the same thing, but again, that was up to them to be able to make that decision, working with their local law enforcement.
Brian from WWT asks if you're familiar with criticisms in Utah aimed at Test Utah. Can you provide an update on Test Nebraska?
So again, who was asking that?
Brian from WOWT.
Brian from WOWT wants to know if I'm familiar with some of the criticisms of Test Utah and what's an update on Test Nebraska. So I've read one of the articles with regard to the criticisms of Test Utah. I didn't actually see any data in there. People were raising concerns about it. I can tell you that here in Nebraska, as we're getting our lab set up, and we'll have more information on this as we get the lab set up and provide that information, we're working to be able to get that lab set up, calibrated. We're going to test it ourselves. We're going to be running it ourselves. All the testing will be done here in the state of Nebraska. And again, we expect to be able to get that up and running here in the not too distant future. And again, our plan is to start testing in Omaha and Grand Island starting on Monday next week.
Rob McCarthy.
And a soft rollout sort of way though. So we're just kind of rolling this out a little bit at a time to be able to kind of make sure we got the system down.
Rob McCarthy from KTV asked did Nebraska vet know me from Test Nebraska at all? And how will we verify NOMI's test results?
So Rob from KTV is asking, do we vet NOMI, and are we going to vet our test results? And so the answer is yes, we did vet NOMI in conversations with Gary Herbert, for example, the governor of Utah. Kim Reynolds had also been able to, had actually was farther ahead in the process than we were, so we also spoke with Kim Reynolds. And again, the technology they're using, folks, is not like brand new technology. This is a polymerase chain reaction testing device. So this is not new technology. This is standard technology. And so we will be setting it up, and we will be verifying when we do to make sure it's calibrated appropriately, and then when testing, our samples to make sure we're getting it right. But I want to emphasize this is not some brand new technology. This is companies who had access to be able to deliver the test kits and really kind of make it a turnkey delivery for us with regard to the machines, the test kits, and all that sort of thing. Though we will be here in the state of Nebraska managing that lab. It'll be Nebraskans that are running it. It'll be Nebraskans who are running the testing sites and so forth. So that will be ours that we're going to be running here in the state of Nebraska.
Alexandra from KTV says Test Iowa is using the state lab. Why aren't we using existing infrastructure? Who will run the lab?
Alexandria is asking, with regard to, in Iowa, they're using the state public health lab. Why aren't we using an existing lab here? And I'd say, just stay tuned. When we are ready to make the announcement about our lab, we will give you all the details about who's running it and all that sort of good stuff. So, but again, we are leveraging existing infrastructure to be able to do this. And again, it's all going to be done here in the state of Nebraska.
Martha at the Long World Herald says the Department of Labor has said that fear of coronavirus is not considered a good reason not to be go back to work if you're called back to work. What about people who live with or care for vulnerable family members? Do they have to return to work?
So the question was, again, if you are, just because if you call back to work, you have to go back and take that job or you're going to lose your benefits, unless you've got a good reason, like say you are one of those vulnerable populations. And the question was, what about if you're taking care of somebody who's vulnerable? And John, I'm going to ask you to kind of weigh in on that one there. Have you guys set some policy with regard to that?
We have generally deferred.
Why don't you come over here?
We have just generally deferred to the physician that's treating the person that's affected, and if they're saying it's not, they need them at home, or if it's too dangerous for that person to go back to work because of the person at home, then we're going to go ahead and pay the benefits. I mean, we're not trying to be draconian by any stretch. We're just trying to, if you've got a job offer and there's not a legitimate reason to go other than a fear, then you should go to work. But, if there's extenuating circumstances, other examples, I mean, if you're one of the parents who suddenly got school-age kids that aren't in school because the school's closed or the daycare's closed, those would be other factors that would justify failure to return to work. The only people we're looking at is the people that are perfectly healthy and don't have a note from a doctor that says this person shouldn't go back to work.
Great, thank you, John. So again, I think the advice is go get a doctor's note.
Michael from the Dakota County Star is asking about disclosing positives related to the Tyson plant in Dakota County. Do you think that's something Tyson should do?
Michael from the Dakota County Star is asking about disclosing positives from the Tyson plant in Dakota County. And again, we at the state, it's our policy, we do not disclose that on a organization by organization basis. So we don't do it for our food processors and we don't do it for our long-term care facilities. So we, the state, are not doing that. And with regard to Tyson, that is going to be up to Tyson whether or not that they want to disclose that information.
That's all I got.
And that's all he's got. All right, great. So questions in the room?
Governor, what's the significance of the President's executive order if the day after he issues it, Tyson announces it's closing a plant?
So the question is, from Fred was, gee, what's the significance of the President's executive order if the next day the Tyson's announcing they're closing a plant someplace? I think what it does is really highlights the importance of why we need to work so hard to keep these plants open. Now, obviously, Tyson needs to make decisions about their businesses, and it's appropriate for them to make those decisions, but we need to work very hard to keep these plants open because this is how we are feeding our state and our nation. And so I think it highlights, the President highlights that this is important and we need to continue to work hard to keep these plants open. And again, we certainly would appreciate any additional help the federal government's going to supply to be able to do that.
But it's phrased, it's described as an order, and yet it didn't have the effect of keeping the plant open, so what is?
So Fred's question is like, well, it was described as an order, but it didn't keep the plant open. And I think it gets back to just the way this entire emergency and all emergencies are run. Locally executed, state managed, federally supported. To me, that demonstrates the federal government supporting us. But at the end of the day, all emergencies are executed locally and supported and managed by the state. Yeah, Paul.
I got a couple of different questions. One is about the Utah testing story, and you said you did read it.
I see. Okay, I scanned through it quickly. I read it, but I didn't see a lot of data in it, so I just kind of.
And it's saying.
So I can't quote you any of the names of anybody who's complaining.
Okay.
That's just where I'm going on that.
But I noticed in the state's contract with these companies, it does say the test should be accurate above average. That's the line, above average. Is that enough to give us a good reading of what we're going to see in our state?
So Paul's question is, hey, it says that the language in the contract says the test should be accurate above average, which means that we want it to be better than kind of your average across the nation with regard to the accuracy of these types of machines. And also, I'd say it gets back to, we're going to set up the lab, we're going to test it, we're going to calibrate it, and we'll know what kind of the accuracy is when we get the chance to be able to get this up and running and get some experience with it.
I had a question about property tax.
Property tax. Really? We're going to ask about property tax? Do you remember the days when we used to argue about property taxes? Don't those seem like the good old days now? I would love to be arguing about property taxes right now. All right, that will give us a chance. Okay, good. Thanks, Paul.
So the property, first half of the year's property tax is due tomorrow. And I'm hearing from farmers and others that say, why can't the governor waive the 14% penalty if we can't pay our property taxes? And I did ask maybe a week ago about why not allow people to pay partial so they aren't penalized for the entire amount of their property tax.
Right, so the question is, for some people, the first half of your property taxes due May 1st. Others had their property taxes due April 1st. So this is just, some people are due May 1st. And, why not waive the 14% penalty with regard to property taxes? It is one of the things that we are taking a look at, but I think we also have to remember that these property taxes, first of all, are not collected by the state, so that's not our money. Those are your local entities that are run on property taxes, whether it's your school system, your NRDs, your counties, your cities, and these entities rely on that property tax to be able to stay functioning. So if you put that revenue at risk, you're risking your fire, your police, your county services, your city services, your school districts, all these different entities that rely upon those property taxes. So we need to be very careful about doing something like waiving even the penalties. So we take a look. So we're looking at that, but it is something that, again, when we're talking about your property taxes, and I've had some conversations just with anecdotally with county commissioners that said, if, for example, we delayed people's paying of the property taxes, they'd have to shut down. They wouldn't be able to make payroll. And just to put that in perspective just a little bit, to give you an idea about how this could impact those local entities, we had our projection for our taxes April 15th. For the month of April, we're going to be something like $397 million. Am I getting that right? Taylor, was it 379 million? It was, something like that. And we estimated that the revenue we lost was about 78% of that, because the date got moved from April 15th to May 15th. So that 397 may not be exactly right, but actually it might be 297. But the point, it was 78%. So we actually saw 78% fewer revenues coming in this month because that date got moved from April 15th to July 15th.
We're talking about just income tax?
We're talking about income tax. So now if you think about that that's actually, I think that's all tax receipts, but again, that date got moved. So the point being that if you took a local entity and said that they only got, say, 25% or a quarter of their revenue, you can imagine they wouldn't be able to make payroll, which is why we have to be really thoughtful and careful about this. So I'm not saying we wouldn't do something like that, but we have to really have a lot of planning and to be able to know what that impact would be and work with our local entities. So it's not something you can just willy-nilly do. You do have to be really thoughtful about how you plan this all out. And that suggestion was made for me, but just we haven't been able to do the analysis to know what that impact would be on our local entities. And so it is not going to be waived, certainly by tomorrow.
I was hoping to ask the pastors what they expect to see in their views, and do they see a return?
Father Kubat, Pastor Snow, you want to come up here and talk about a little bit about, but stay 6 feet apart, I'll be in the back. Talk a little about what you expect to see.
Do you think all the churches are going to reopen? Do you think everybody's going to come back to Mass?
Well, there's a lot of discretion. The question was, do you expect all the churches to open up? And there's a lot of discretion to local pastors. That's one point. But my sense is when things open up, the numbers are going to be down quite a bit because there are people that are at risk are going to stay away, and there are people that live with people that are at risk are going to stay away, and people are wary. And there's a lot of elderly, so there's going to be a lot of people that are going to stay home. So I'm expecting that the crowds are going to be less, but the people that are able to come to Mass will be able to, following those guidelines and restrictions. So, but I think the numbers will be down.
Do you think you'll see wedding ceremonies return?
The question was, will we see weddings? Well, that's a tricky thing because although we can have weddings, but then the receptions. And so I've already rescheduled some weddings because they kind of go together. So you want to, bride and grooms want to have their family, friends, and loved ones there. And it's different to social distance themselves, especially on the dance floor, at the reception. So I expect that there's going to be a lot of weddings that are going to be rescheduled. And funerals, we do funerals, we can social distance. That's a lot easier. And a lot of families will forego the funeral luncheon, so.
I've talked to a number of congregations that actually have postponed starting till June, kind of maintaining the May guidelines still. So especially a lot of the larger congregations where the logistics of having members back. Those that are coming back, as Father mentioned, their numbers are going to be decreased just by nature of the mandates. The other thing I would say is, again, a lot of the churches are finding pretty good response to the digital presence. And so in a lot of those situations, their attendance is higher than face-to-face. So they're going to maintain that digital presence anyway, and that too, I think, will keep numbers down as well. I think a lot of it will depend upon the region. We've got some areas where internet coverage and that is quite poor. And so we have a number of congregations that simply can't have digital presence because they don't have the upload speed and folks don't have the internet speed to receive the signal either. So I think in some of those rural areas, some of the remote spots, and especially those that really have kind of no COVID cases, those I think you'll see those congregations opening up sooner and probably a better response just because there's been such an absence in the past.
Yeah, I know pastors hate to give the money sermon, but what's this done to your plate collection? I mean, are you guys struggling to keep the lights on?
So the question was about kind of the generosity of our members, and that's really, it's varied, but generally speaking, the pastors have been pretty positive about folks' generosity, their willingness to continue supporting the work of the church, recognition that the work of the church and some of our schools as well, those things continue. And so my guys at least have been generally very positive about the generosity of our Nebraskans. We got good folks.
Do you think more than half of the churches are reopened? We're talking about the bigger churches.
I would guess that, yeah, I mean, again, probably for the Lutheran Church Missouri Synod, we have about a third of our 240 congregations that are in dual or triple parish situations, so these are small gatherings to begin with. You're talking about 25 to 50 to 60 folks. Again, a lot of it will depend upon the space. Most of those congregations, I think, will open as they're ready. Again, none of my guys are saying, man, May 4th, Monday night, we're cracking it wide open. Everybody really understands we're here to care for those who are weakest. That's why we've done all of this to begin with, care for those and care for our medical, system. So I think that care and that concern that we have for our neighbor is going to continue to motivate the way we do, and really everybody's talking about a slow roll, that they really want to just kind of take things very, very, slow and move forward at a good pace.
We have time for a final question.
All right, one more question. We'll go to the cameras in the back. Brandon.
Regarding the fact of the health departments being able to share info at their discretion with law enforcement, is there a reason to not change the executive order making that so that they need to do it in light of the fact that the law enforcement in those areas are less safe?
So Brandon's question was, can you change the executive order to make the public health departments comply with the requests from law enforcement, and actually the answer is no, I can't. I can only waive statutes. So we can waive certain statutes that allow us to be able to share data, but we can't compel it. So actually, that's not an option for us to be able to do that. Again, folks, thank you very much. Appreciate everybody taking the time here today to be able to talk about what the state is doing. I want to say thank you to all the Nebraskans over the last 21 days who have stayed home, stayed healthy, and stayed connected. Remember, we still got our 6 rules, though. May will still be under the 10-person rule. So tomorrow, we'll still be under a 10-person rule. We want you to still follow these 6 guidelines to help everybody stay healthy. We want to continue to slow the spread of coronavirus here in Nebraska. We do have new directed health measures that will start going in place next month, starting Monday, May 4th, with regard to things like the worship services or the elective surgeries. In some places, restaurants will be able to operate at 50% of their capacity, again, with certain restrictions. But please check with all your local public health departments if you have any questions with regard to how that will work. And again, we'll be back here tomorrow at 2 p.m. Central Time. Tonight at 5 p.m. Central Time, we'll have our Spanish language briefing. Be on NET at 8:30, and we will see you all back here again tomorrow. Thank you all very much. Appreciate it.